Hi, Paul Coleman, Coleman Center for Cosmetic Dentistry with this week's Dental Health with Dr. C. What I'd like to talk about today is something that's actually rampant through society, and it doesn't get treated well, it doesn't get diagnosed. It's TMJ. Now TMJ, what does that mean? Not much, frankly. TMJ stands for temporomandibular joint. So that's like if you had a bad knee, they say, oh, you got knee. Better terms are myofascial pain syndrome or temporomandibular dysfunction. But it's when the pieces of your head and neck don't work well together. So what are the components of this? Well, you have your teeth, and your teeth line your jaws up in space. And if you have enough teeth, you may have 2 bites, but for the most part, you got a place that you land, and your brain said, that's a comfortable place. The brain really tries to minimize damage. We don't like to hurt ourselves. So we've subconsciously figured out the best way for our teeth to fit together. So when the teeth line up the jaws in space, you get 2 other components. You have the joint apparatus and the muscles of the head and neck. Now, when this spatial relationship of the upper and lower jaw do not work well with the joint, you have what most people think about TMJ. They have the clicking, popping, you snap, you have difficulty opening wide or staying open for a long, even for getting your teeth cleaned. If you're exhausted at the end of the cleaning, you know, there's something that's not quite right there. So the joint may or may not like the way your teeth line your jaws up. The other component of it is muscles. If the muscles are overworked to get your teeth together, it exhibits itself in headaches, and more days are missed from work in this country because of headaches or any other reason. It's kind of wild when you think about it, headaches. How much Advil gets swallowed on a monthly basis in this country? So it can give you headaches, it can give you ear problems, it can give you ringing in the ears, it can give you vertigo, slushy sounds. It can cause pain behind your eyes. And as we get older, we start to accept these aches and pains as part of normal living, but it's not necessarily so. It can cause numbness in your fingertips. It can cause you to have insomnia. It interacts with the hindbrain, and this very convoluted domino effect things can actually cause sleep disruption. You can have a tendency to clench or grind your teeth, and this adds to muscle fatigue, and some of this muscle fatigue then pulls on other things. So if the muscles are pulling on the dirt of the brain, you get headaches. It's kind of common sense. Unfortunately, it's mistreated for the most part in this country because it's mistaught in most of the dental schools still. And when I was kind of exposed to something called neuromuscular dentistry, it was sort of like, duh, this makes sense. So by and large, what happens in this country, if you walk in the dentist door with a bad bite, it doesn't get diagnosed because most people don't know how to treat it. So if you come in with a broken tooth or you need a filling, we put the crown in and we have you tap on that little blue paper and we grind and grind and grind until you say, yeah, you finally got it. Okay, we finally got it. What we've done is you came in the door with a bad bite, and we try to get you out the door with the same bad bite that you used to. Okay? So there's a number of ways that through the years we've tried to treat this, but for the most part it's been mistaught because everyone's assumed that this is a hinge. It's never been a hinge. For the first 20 millimeters of opening, you actually have a joint that slides down a ramp. And you can even do this at home, well, unless you have long fingernails. Put your fingers in your ears and you start to open, you'll notice the first thing that happens is that joint slides down this ramp. Okay? So all the philosophies that are taught in dental schools have considered this a hinge, and it never was. So when I was exposed to neuromuscular dentistry, it was, okay, let's take a different approach. Let's find a place where the jaws in space line up so the muscles are comfortable. And that generally means that the jaw comes down and forward, and the muscles are in a little happier spot. Now, we don't really think as much about the joint because when we relax the jaw down and forward, it decompresses the joint, getting rid of the clicking and the popping and the inability to open. So this is kind of cool. It's a little different philosophy, it's a little bit more work, but it doesn't involve surgery. The treatment and diagnosis is reversible. And if this is something that you suffer from or think you suffer from, I'd be happy to talk to you about it. Call for a consultation or look up a neuromuscular dentistry in your area, because this is a very specific, qualitative, quantitative, measurable improvement in your life. So if you're afflicted with any of these problems or know someone that is, please give us a call. Paul Coleman, Coleman Center for Cosmetic Dentistry, or visit my website, www.drpaulcoleman.com. Click on TMJ and you'll find out more information than you could possibly want. Look forward to hearing from you. Thank you.